yeah, it's because we think that it's better for the health professional and also for the other people and also the family. And also we advocate for reward for the nurse or health professional in general that already struggling to take care of patient, to take care of the COVID-19 patient with brave. So we think and we advocate the government to give reward for them, yeah, for so the government give an incentive and also give some advantage for the nurse or health professional in general that uh, already struggling to care for the COVID-19 patient. Yeah, I think that's all of my slides. If any other questions or comment, please, and I give it the screen to the moderator. Thank you, Sausan.
Okay, thank you so much, Nurse Moin, for your enlightening presentation. We will have some excellent discussion from our audience, I guess. We'll have a Q&A session with our speakers, so please do raise your hand or use the Q&A chat box to submit your question. For the Q&A session relies only for 3 questions, so anyone wants to ask? Okay, I think while we wait for the audience to ask, I'd like to ask you about this topic. Can I, sir?
Yes, please.
Okay, thank you. Since we know that Indonesian National Nurses Association or PPNI or healthcare providers and we as humans is plays a huge role to this zoonotic disease to prevent, to respond, and something. Um, so I'd like to ask, how does the PPNI contribute to the training and education of nurses regarding the zoonotic diseases and best practices in patient care? Um, are there any specific initiatives or programs led by PPNI that are aimed at enhancing nurses' preparedness for emergencies related to zoonotic disease outbreaks? I guess that's what I wanted to ask, sir.
Yeah, it's good questions. Uh, PPNI actually, I think, yeah, I think uh, that quite new to realize about this important thing of uh, important thing of this program. Yeah, so actually that not many program that had already conducted by PPNI to support this important thing of to us, but we PPNI is already moved to make it better. So we PPNI has cooperation with other parties that uh, as a stakeholders of disaster in general or epidemic, especially in yeah. So we have already cooperation with the uh, Badan Nasional Penanggulangan Bencana, ya, because uh, they are main stakeholders of disaster countermeasure, including epidemic, like the COVID-19 situation. So we have already cooperation with them, and we had a plan to do some trainings for the nurse to be more competent of how to countermeasure this disaster in general or epidemic. So I think that's a better movement, yeah, for the PPNI if we compare with the past years than before the COVID-19 era. And also we do with the other parties to have cooperation.
Okay, thank you so much for the enlightening, Nurse Moon. Yeah, since we don't know when will the zoonotic disease spreads again, like just as the COVID spreads back then. So I was questioning the preparedness for the nurses. Like no one is ready, including the healthcares as well. So yeah, will be the I guess it will be the new uh program for the nurses preparedness, I guess that will need to be think about by the PPNE,
Yes.
right?
Yeah, you are right. We have to prepare because the zoonosis disease, like we discussed about that, it consists of 60% of the total infectious disease. So in the next uh, era, I think it will be uh, other zoonosis disease, both re-emerging or new emerging zoonosis disease. It will be. So we have, you are right. We have to prepare well, better. Yeah.
Okay. Thank you so much, Nurse Moen. I guess we need to back again to the participants. Are there any questions? You guys can raise your hand or drop the question at the chat box if there are any.
Already clear or sleepy?
uh,
Was
I guess
already afternoon.
I guess we're gonna wait until 13:37, the minutes by now. Anyone who wants to ask, please to raise your hand or drop your question at the chat box.
Yeah, actually we have like we have discussed before that we have so much lesson from this COVID-19 pandemic. Yeah, we can imagine that we can do like this seminar, yeah,
Yeah.
online, yeah. we have we can do anytime, yeah, anyhow to share our uh, idea or our knowledge each other, right?
Yeah, you're right. I guess we need to do more seminar upcoming
Yeah,
about
yeah,
the zoonotic diseases
yes,
to prepare for the community as well, right?
yeah.
Okay, I guess there's no more question for from the participants. I guess it's clear enough. I guess there's no in.
Okay, thank you Mbak Susan and All of you,
Okay.
yeah. See you.
Okay. Are there any close remarks from you, Nurse Muin?
uh, yeah, I think that's my last sentence is that we have uh, many lessons from the COVID-19 pandemic that we have as a nurse uh, in that time, yeah, in that time that the healthcare is need a nurse, yeah, very need nurse, but in that time there limited nurses. Yeah, so I think for nurse, for us, it is this pandemic is could be not just disadvantage actually, but also many advantages for us if we can learn from it. We can do we should find other competencies that now time we can, I think we can take it, or we can have it easily, like this discussion, right? Yeah, I think that's from my my closing standard. Yeah.
Okay, thank you so much, Nurse Moen. Since we already reached the end of the session, I want to express our deep appreciation to you, our speaker, and all of you in the audience for your engagement and interest. Um, Before we close this session, I'd like to take photos online with you and your audience. Can
Okay.
we? Okay,
Yes.
for the audience, please do turn on your camera since we'll take a screenshot together. Okay. Anyone wants to open the camera again? I'll wait. Okay. Okay, I'll take the screenshot on 3, 2, 1. Cheese. Okay. Okay, thank you so much, Nurse Muin. I'd like to give an overview from your presentation. Can I?
Oh yeah, please. Yeah, of course.
Okay, from your presentation, I'd like to do an overview of zoonotic diseases and the pivotal role played by the PPNI. We've underscored that the Indonesian National Nurses Association, or PPNI, plays a central role in preparing nurses to address the challenges of zoonotic disease effectively. Their influence extends beyond patient care to community education, research, and policy advocacy. By recognizing the role of nurses and supporting their initiatives, PPNE contributes significantly to the overall health and safety of the nation, particularly in the face of zoonotic disease threats. As zoonotic diseases continue to evolve and pose global challenges, the commitment and proactive role of nurses under the guidance of organizations like the PPNE are more crucial than ever. Through their dedication and expertise, they serve as essential pillars in protecting public health and building a resilient healthcare systems. Okay, so um, ladies and gentlemen, I'd like to appreciate our speakers. Again, thank you so much, Nurse Muin, for your time and for attending this seminar with me and with us all. Thank you so much.
Yeah, you're welcome, Mbak Susan. See you. Thank you for you too, ya. Good moderator.
Okay. Okay.
Yeah.
Okay.
See you, Mbak Susan, and all of you, ya. Always
Okay.
healthy and wealthy also.
Okay.
Yeah.
Thank you so much, Nurse
See you soon.
Muin.
Yes.
Okay. Ladies and gentlemen, for the next agenda, we will have the last presentation and discussion in the area of the emergency nursing according to the guidance in handling rabies as a zoonotic disease. The speaker of the session is Nurse Nana Rohana, SCAP MN from Universitas Diponegoro. Ladies and gentlemen, I'd like to read you a short biography of Nurse Nana Rohana for the organizing committee. Okay. Ladies and gentlemen, Nurse Nana Rohana is currently a lecturer in the Department of Nursing, Faculty of Medicine, Universitas Diponegoro. She obtained her master's degree in nursing from Monash University, Australia in 2013. Her research interests include emergency and critical care nursing, acute care, and disaster nursing. Okay, without any further ado, ladies and gentlemen, please welcome Nurse Nana Rohana.
Check, check. Can you hear my voice?
I'm sorry, Nurse Nana. I don't really hear your voice clearly.
Okay. Okay. Now can you hear me? Can you hear
Okay.
me?
Okay, this is better.
Okay. Is it clear enough?
Yes, but it's
All
quite
right.
low.
It's too low. Hang on. I'm going to yeah. Okay. Give me a minute.
Okay. A bit.
Check, check.
Still a bit low, Nurse Nana.
All right. What about now? Hello?
Okay, this sounds better.
Okay. All right. Thank you. Just let me know if
Nurse Nana, I'm so sorry. You got unmuted.
yeah, I'm muted. Sorry. Okay, thank you, Mbak Sultan. Yeah, good afternoon, all the participants of PIHO. Yeah, is it the PIHO activity, right? Okay, I believe that some speakers have already shared about zoonotic diseases. Yeah, and now my turn is about the rabies. Especially the emergency management in the rabies. So I'm going to try to share. Okay. Oh. Sorry, my Zoom and then my voiceover not be solved. Yeah. All right, I'm going to let's share it. Okay. Can you see my slide?
Yes, ma'am.
Okay. All right. Okay. About the rabies. I believe some of you have already heard about the rabies. Anyone knows about the rabies? This is one of the zoonotic disease and most frequently and deadly one. Anyone want to share your maybe what you know about rabies? Yeah. So that I can figure out whether I'm speaking alone here or whether you are with me now. Anyone can open your mic and then maybe share about your knowledge about of the rabies. No one? If you don't know, maybe something that you know related to the rabies. Something?
I guess from the participants.
Mm-hmm. Anyone?
Anyone can raise your hand, please?
Yeah, or you can speak up, or you can type in the chat, on the chat box. If you don't know about rabies, maybe something related to the rabies, that famous one. Hello.
I guess they're too shy, maybe.
Oh, okay. Okay, don't be shy, yeah. Because something that you want to know, you better say it out loud, yeah. Because that's why someone will know what how far you know about that topic. All right, so I'm going to just go straight about the rabies. All right. So the rabies, yeah. I want to say something about some facts about rabies. If you have already known about rabies, something that is related to rabies is dogs, yeah. You know dogs, right? Or puppies, yeah, dogs, puppies, yeah, or maybe bats, yeah, or some animals, yeah, carry the rabies viruses. So some facts about rabies. Rabies is a disease, yeah, affecting central venous system, and then almost 100%, yeah, of the fatality once the symptoms appear. So this disease has such quite long incubation period. So during the incubation period, it is better to get the correct treatment and then also the prophylaxis. Otherwise, when the symptoms appear, so it will be difficult to cure this disease. So you can see this is a bite mark. Yeah, this is the dog bite mark. And sorry. This disease, yeah, is caused by animal bite. Some animal bite which carry the rabies viruses. However, almost 99% of the rabies disease, yeah, caused by the dog bite, yeah. So it's not only bite, yeah, but also the saliva, or maybe like contact, yeah, with non-intact skin, or if we got some fresh wound, or maybe some non-intact skin, yeah. So it will be easily for us to get infected by the rabies viruses, yeah, especially if that animal, for example, dogs or a raccoon, yeah, foxes, bats, yeah, carry the rabies viruses. And once the symptoms appear, yeah, I'm going to discuss about the symptoms later on. The fatality or the mortality almost 100%. Yeah, so it's difficult to cure the rabies if it has been it infects the human. Yeah, and it has high mortality. Yeah, especially in Asia and Africa, because these regions, yeah, some regions in this country, they didn't have like sufficient vaccine for the dogs, yeah, or maybe for the animals, yeah, and almost 40% of this mortality involving the children under 15 years old. So because mostly children under 15 years old, they often they often play with the dogs, with their pets, yeah. So that's why the cases are mostly involving 40% of the children under 15 years old. And also, yeah, like I said before, the incubation period for this disease, yeah, actually quite long. So about 2 to 3 months, but it may vary between 1 week to 1 year. So the maximal incubation period can be until 1 year, and then the fastest, yeah, the quickest one is a week, yeah. But commonly, the typical incubation period within 3 to 2 months. Sorry, 2 to 3 months, yeah. So within that period, yeah, the patient who get infected by the rabies virus should get the appropriate treatment. And then, okay, the causes of the rabies, yeah, animals, yeah, infected by the rabies viruses, such as dogs, yeah. In Indonesia, some animals, especially the domestic animals, yeah, like cats, yeah, or maybe some of them are wild animals, but the domestic animals can also cause the rabies, yeah, like dogs and foxes and raccoons, yeah, cats, yeah, and then also monkeys in Indonesia. And actually, this is a preventable disease, yeah, especially for those who are working or maybe living near with the animals or pets, yeah, they need to get like a prophylaxis or the vaccines, yeah. The dog also should get the vaccine, and then the humans should also get the vaccine. All right. So you can see this is the virus of the rabies, yeah. Okay, this is the description of the rabies viruses, yeah, consisting of matrix protein and glycoprotein and ribonucleic protein, and then also membrane. It can last. It can last. Yeah, the virus can last for about 30 minutes. Yeah, in 56 degrees Celsius environment. So when the heat temperature reaches 56 degrees Celsius, it can last for about 30 minutes. So, however, in the temperature of 100 degrees Celsius, so it only can last for about 2 to 3 minutes. So when we want to make the virus dies, we can heat it, yeah, or we can boil, yeah, some things that or some object that is infected, or how do you call that? It is attacked, yeah, by the virus. So we can clean it, and then we can boil it, and then or heat it, yeah, until the temperature of 100 degrees Celsius, yeah, for at least 2 to 3 minutes. So 5 minutes or 10 minutes is okay for the heat to make the virus die. And the virus also dies in the exposure of the sunlight, yeah, the ultraviolet rays, and then acid and base conditions, ether, chloroform, like the alcohol, and then also soap. Yeah, this is very important. That's why the management, the first aid management of the rabies bite, the dog bite, yeah, will contain this, yeah, soap. Yeah, it is easily, this thing is easily to get and then easily to apply. However, it contributes to the most significant important thing for the management of the rabies. And this is the virus pathogenesis of the rabies. Yeah. So, for example, once the virus enters through the animal bite, for example, the dogs, yeah, when the dogs get wild or maybe they are agitated, yeah, they will bite, yeah, even for someone who are close to them, yeah. So through the dog bite, yeah, the virus will replicate in muscle, yeah, of the bite region. So, and then after that, after it replicates, it will infect the nerve in the peripheral nervous system and move retrograde transfer. It will move up, yeah, upward, yeah, to the brain, yeah. And this virus transmits, yeah, through the body via nervous system. Yeah, it does not transport via blood vessel. So this virus is difficult to recognize through the laboratory examination. That's why it is difficult to diagnose this disease when it is still in the incubation period, yeah? Because it does not transport, yeah, it does not spread via the blood circulation, yeah, but through the nervous circulation, yeah, the nerve system, and then it will go upward, yeah, and then go to the brain, yeah, and then it will travel from the brain, yeah, to the other tissue, yeah, such as eyes, kidneys, salivary glands, yeah, once the brain infected, yeah. So this main target is the nervous system and then go to the brain, yeah. So we will see like meningitis symptoms, yeah, to the patient infected by the rabies virus. And then after the brain is infected, the virus will travel down to the other organs. So it will damage every organ after the brain. Okay. So it's when you see this pathogenesis, we will figure out that this virus is very dangerous, yeah, and difficult to cure, yeah, because once it is once it infects the nervous system, the mortality or the fatality will be higher. So that's why the prophylaxis can reduce, yeah, the symptoms, and then also in the hope to eliminate the virus so that it won't affect the brain. But once it affects the brain, yeah, so the mortality will be higher. And then this is the types of the rabies disease. There are two types, yeah, and then it also can occur in the human, also among dogs, yeah. So among humans who are infected by the virus, or the animals who are infected, which are infected by the virus. So the first will be the furious type, and then the second is the paralytic rabies. The furious type will be the common type of the rabies, while the paralytic type or only just appear 40% of the overall cases. So we sometimes see when you have like a domestic animals or your pet, yeah, including cats, yeah, even though it is rarely infect cats, but there are a small number of cats that are infected by the rabies virus as well. Yeah. So when we have like a pet at home, yeah, we need to monitor their behavior. We need to get to know well whether they are behaving like a normal behavior or abnormal one. So we will sometimes we need to get like quick or the rapid assessment for them, or maybe do not forget to get vaccine for your pet, yeah, because vaccine can at least reduce, yeah, even though animals who get vaccine by the rabies vaccine is not almost free, yeah, from the rabies, but at least the probability of the rabies infection can be lower, yeah. So the various types will be like hyperactivity, yeah, excitable behavior, hallucinations, yeah. It can happen both in human and then also animals, yeah. Lack of coordination. So that person who are infected by the rabies viruses, they will act like agitated, yeah, hyperarousal, yeah, hyperactivity, and appear some phobia, yeah, like hydrophobia or maybe aerophobia, yeah. Hydrophobia is the fear of water, yeah, and then aerophobia is the fear of fresh or fresh water. Yeah, so that person will get terrific. Yeah, I mean, we get afraid. Yeah, of water. Yeah, when they see water or when we get in touch with water, they will be frightened. Yeah, that's also one of the symptoms of the furious rabies. And then after this symptom appear, yeah, gradually, they will be having like a cardiorespiratory arrest for as the most causes of the death, yeah. So the the problem with the cardiovascular and then also respiratory problem very quick, yeah. It is very quick from the symptoms appear, and then after that they will have like a dropping or worsening condition involving the radiopulmonary problem or the failure resulting to death. So it is we need to monitor that. I'm going to talk about that later, about the management of the rabies. And then the second one is the paralytic rabies or the paralytic type. Yeah, in the paralytic type, that will be vice versa. Yeah, the opposite of the various types. The paralytic will the paralytic symptoms, yeah, will appear such as like muscles, yeah, or the paralyzed muscle, yeah, and then like hypotonic, yeah, muscles, and then slowly level of consciousness of the patient will decrease, and then eventually, just like, do you know the Guillain-Barré syndrome? Yeah, when the person lost their tonic and then they become paralyzed, yeah, from the peripheral muscle, and then after that go upward, then after that involving the respiratory, and then also whole muscle, yeah. So it will result in the respiratory failure. So this type of patient will need like assisted mechanical ventilation, yeah, because they cannot they don't have like a spontaneous breathing. They will be difficult to breathe. That's why they need like a mechanical ventilation or the breathing support. And usually the patient with the rabies or the rabies patient, they commonly are admitted in the intensive care unit. And this is the symptoms, yeah. What I told you before in the previous slide, that show about the type, yeah, and then also the symptoms of each type. However, before that the latter symptoms develop, yeah, the initial symptoms will first appear. For example, this is just like general flu-like symptoms, yeah, or maybe a virus-infected symptoms, yeah, such as fever, and then pain at the wound site, yeah, or the bite site, and then unusual or unexplained tingling, yeah, prickling, yeah, and then a burning sensation at the wound, yeah, and then also progressive and fatal blemishing of the brain and then spinal cord, and then also the sign of meningitis. And after the sign of meningitis appears, so they will both like show, yeah, whether serious or the paralytic symptoms. So it's difficult. Once more, I emphasize that it is difficult to diagnose or maybe to decide, to determine whether someone is infected by the rabies or the other viruses, yeah, because the initial symptom is very similar. So, okay, the transmission, okay, we need to be careful, yeah. This will be including into one of the management of the rabies, yeah, prevention exactly. Particularly, it is the prevention, because the transmission of the rabies is through the animals, yeah, with the rabies viruses, yeah, contact with non-intact skin or mucosa, mucose or fresh skin wounds, yeah, with the bite, saliva, and also direct contact, yeah. So direct contact, yeah, for such as with the fur, yeah, or maybe like the dog kiss you, for example, and then you also kiss the dog, yeah. So be careful with that behavior. So sometimes, yeah, we are not aware of that, yeah. We only think about, okay, once the dog bites, yes, but honestly it does not only involve the bite, yeah, but also its saliva, yeah. You know, the saliva of the dog, and then also the direct contact of the dog, because sometimes the surface of the fur, yeah, there will be like their sweat, yeah, something like the human as well, yeah, even though the skin, yeah, even though we have like a hair, yeah, growing from our skin, yeah, the skin will produce like a sweat, yeah, or oil, yeah, that's the body fluid, yeah. So when it's contact, it can also infect, yeah. But we need to remember, yeah, these three components, yeah, which will be contacting with the non-intact skin, yeah. So for example, if we have a direct contact with the dog, yeah, but we don't have any wounds, yeah, or it is not involving the mucus or maybe like a eye or maybe a mouth, your mouth, eye, yeah, that's the mucus there. So we can be feeling safe. So because the transmission will be lower through that method. We need to remember this contact will be with non-intact skin, yeah, or like a wound, yeah, on the skin. So that's why some preventions need to be made, yeah. For example, eliminating rabies in dogs. It will be safer when we have pets or the domestic animal like cats, yeah. We will have them vaccine, yeah. So this is the example of the vaccine chart of the pet, yeah. So at least there are especially for the pets who are having canines, yeah. Taring, yeah, in Indonesia it is called taring, yeah. And then it is carnivore, yeah. Eat meat, yeah. It is eating meat. So at least for basic vaccine for our pets, yeah. This is the core vaccine, and then also it can be vaccine by leptospirosis, yeah. And then this is the rabies will be given during the third and then the fourth vaccine, yeah. And then annually, yeah, and every 3 years, yeah, it can be repeated, yeah, like a booster vaccine, yeah. And then also the rabies immunization, yeah. For if that vaccine, the previous one, yeah, that's for the pets or the animals, yeah, this immunization will be given for the humans, yeah. There are two kinds of immunization, the pre-exposure prophylaxis and then also post-exposure prophylaxis. The pre-prophylaxis will be given before, yeah. This prophylaxis, this vaccine will be given for those who have been working with animal related, for example, yeah, like veterinarian, or maybe the officer in the zoo, yeah, and then those who are working involving a lot, yeah, with the animal, yeah, so they need to get vaccine. For the human who has pets also, they can get this pre-exposure prophylaxis, yeah, and it will be safer for them to get it. And then also post-exposure prophylaxis. This is given. I will show you the chart later on. Yeah, after the bite. Yeah, for example, if you have like those conditions, yeah, bite and then also direct contact, yeah, or contact with the saliva, yeah. So it is better and then safer to get the post-exposure prophylaxis of the rabies, yeah. So there are 3 doses for the vaccine, yeah, and then it can be given the booster, yeah, every 6 to 24 months, yeah. It will give the immune for 10 years, yeah. So for 10 years, you will be immune for the rabies virus, yeah. That's the recommendation from the WHO. Yeah? However, you know, like the vaccine on immunization, sometimes, yeah, we still can get infected, yeah, even though we have already got the immunization. Yeah. But the chances will be reduced. And this is, I'm going to show, yeah, this is like what I want to show you earlier. The rabies post-exposure prophylaxis modalities, yeah. So there are 3 categories of the prophylaxis, yeah, especially the post-exposure, yeah. We call it PAP, yeah, post-exposure prophylaxis of the rabies, yeah. So when we touch or we feed animals and then or maybe the animal licks our intact skin, yeah, or we contact, but we don't have any wounds, yeah. So we don't need to get the PAP modality, yeah. We only just wash, yeah, and then wash our body with the soap, yeah, to prevent the rabies or to eliminate the rabies virus. Yeah, so this should be remembered. The category 1, yeah, contact with the intact skin. Yeah. The category 2, yeah, nibbling of uncovered skin or minor scratch or abrasion without bleeding, or maybe when your cat or the dog, yeah, accidentally scratch you, yeah, but you don't bleed, yeah, only just a minor scratch, yeah. So you should get vaccine, yeah. So the PAP is required, yeah, it is recommended. And then the category 3, yeah, it is involving single or multiple transdermal bites, yeah, or licks on your wound, yeah, or maybe the contamination of the mucous membrane, and then the exposure to bats, yeah. So the vaccine to be given plus the rabies immunoglobulin, yeah. So like what I want to explain, this one, yeah. The management of rabies, yeah, includes the extensive washing with water and soap for at least 15 minutes, and then also local treatment of wound, yeah, give antiseptic. So we need to wash our wound or the bite mark, yeah, for at least 15 minutes, yeah, under the flowing water, and then also use soap, yeah, because like I said before, the virus can be killed by the soap, yeah. The acid or the base condition will make will kill the virus. When we wash, yeah, it is not only with the fresh water or the clean water or the sterile water, but we also apply soap, yeah, with the among the water, yeah. So put the soap, yeah. Do not scrub it because it will create the wound larger, yeah. So just gentle, yeah, giving soap, yeah, and then after that wash, yeah, in the flowing water, at least for 15 minutes. And then after that, you apply the wound with the antiseptic, the povidone iodine, or maybe the alcohol will be better because ether or the chloroform can also kill the virus. Yeah. So even though it will be hurt, yeah, or it is tingling sensation when you put the alcohol on the wound, yeah, it is painful, yeah, but we need to we can do that measures, yeah, to kill the virus, or you can put the povidone iodine and then give the vaccine, yeah, like post-exposure prophylaxis, yeah, like what I have already shown you in the next slide, and then also after that get the rabies immunoglobulin, so like a protein, yeah, like a immunoglobulin for the rabies. And then this is the emergency management of rabies. sometimes when people who were infected by the rabies, was they were brought to the emergency department. Usually they show like the later symptoms. When they show the later symptoms, it will be difficult to cure, to treat. So that's why we only we need to assess and then also to provide management consisting of the airway, breathing, circulation, disability, and exposure. Because sometimes the patient has already decreased their level of consciousness, like they are unconscious, or maybe delirium, or maybe a coma, and then so we need to find also the sign of meningitis, and then also sign of paralysis, or maybe the furious one, the furious state, that's in the disability section, But first of all, we need to provide, or maybe we need to manage the airway, like open their airway, or maybe clear the obstruction, any obstruction, maybe have hypersalivary, because in the furious type, they tend to show the symptom of the hypersalivary, it can create like airway obstruction, so we need to do the suction, and then also do intubation to the patient, because in the paralytic type, like I said, like I have already mentioned before, they need to be given any mechanical ventilation support, because their respiratory muscle, cannot work optimally, They will be paralytic, They cannot inflate or maybe deflate, So they will not be having the spontaneous breathing, and then give the oxygen support to them. Then the circulation, maybe we need to give like a fluid resuscitation, increase the cardiac output, and then manage the shock state, and then also control and monitor the hemodynamic status, because this is very important. When I have already said that death of the rabies infected patient, commonly are due to the cardiopulmonary arrest, so they will end up into the state of the cardiac arrest or the respiratory arrest, and then after that will result, and so that's why we need to prevent that state, even though it's quite difficult, and then you know what, the immunoglobulin is not cheap, it's expensive. That's why the treatment of the patient with the rabies, is very high, because once they are admitted, they will be given like a prophylaxis and then also immunoglobulin, to reduce the replication of the virus, and it will cost a lot. Then also the exposure, we need to inspect and then manage the bite wound, and then also other exposure. So sometimes when the clinical symptom or the later clinical symptom appear, the wound doesn't exist anymore. It has already been cured. So it has it is cured. But the virus comes into the body and then transferred to the brain. So it's difficult. And then you see this one, this is from the publication of journal article, the conclusion of this article say that the current recommendation of all form of rabies are palliative. So once the symptom appears and then it affects the brain, so the treatment of this patient will be palliative treatment, palliative care, yeah, because there is no cure. At the moment, there is no cure. Once the clinical symptoms, yeah, especially when meningitis happen or occur, yeah, it will be difficult to cure, yeah, to treat. So the aim of the care or the treatment is to lessen the agitation, to relieve suffering, yeah. So because they're agitated and then they are hyperarousal, so they will get like fatigue, yeah, and then it's really painful, yeah. So that's why their suffering, their pain will be reduced by the sedation, yeah, analgesic or maybe antipsychotic, yeah. However, if it is the paralytic type, it will be different, yeah. Coma induction therapy with the Milwaukee protocol with high dose anesthetic agent, yeah. So sometimes that patient will be induced into the coma state to reduce the suffering, yeah. They give like anesthetic agent to create the coma condition or the coma state to the patient. And then most survivors of the rabies were bad variants and person with non-classical form of rabies, yeah. If and then most survivor, yeah, got the rabies vaccine, yeah, so, prior to development of the symptoms, yeah. So during the incubation period, they will get the post-exposure prophylaxis, yeah, before the symptom is developed. Yeah. This type of the patient will likely to survive, yeah, from the rabies infection. Okay, that's all. Yeah, this is the references of this material, this topic that I use. And if you're interested in reading more, you can go there, yeah. And then there will be like a pocket book, yeah, from the Ministry of Health, the Republic Indonesia, to manage the rabies cases. I think that's all to me. Thank you, and I will give my time and also the screen to the moderator.
Okay, thank you so much, Nurse Nana, for your enlightening presentation. I guess now we will have some excellent discussion from our audience, okay? We'll have a Q&A session with our speakers, so please do raise your hand or use the Q&A chat box to submit your questions. The Q&A session relies only for 3 questions, so anyone wants to ask?
Yeah, feel free to ask. Or maybe getting late, yeah? Getting late, getting no question.
Ma'am, while we wait for the audience to ask, can I ask you a question about this topic?
Yeah, sure.
Okay. I'd like to ask you about the vaccine for preventing rabies. You mentioned earlier, the post-exposure prophylaxis or PP. Um, I guess for the people who live in remote areas or in the areas with minimal health facilities, I guess they're too challenging for having the vaccine. So, from your point of view, I'd like to know what are the challenges or an ethical consideration that nurses may encounter when dealing with patients who have been exposed to rabies, especially in cases where PEP is delayed or unavailable on the area.
All right, thank you for the question. That's a good question, Sausan, yeah. In some areas that PEP is still not available, so it will be very sad, yeah, because I think the government should supply, yeah, to reach like a public health center and then also the local hospitals to have like not only the snake bite vaccine, yeah, but also the rabies vaccine. In case there is no vaccine, yeah, the optimum measures that we can do, yeah, maybe just like give the life-saving intervention or maybe supporting intervention, yeah, appropriate with their symptoms. For example, how do they, what kind of symptoms they will show, yeah. So we give the treatment, yeah, appropriate with their symptoms, yeah. For example, if there are brought to the emergency department with like various symptoms, so we need to give like sedation, yeah, and then maybe like and the anxiety, yeah, to the patient, and then give the oxygen support, yeah, and then because sometimes when the symptom appear, the wound no longer appear, so that's why we don't need to clean the wound and then do the first aid to the wound, yeah. That's once the bite occurrence happen, yeah. But if it has already been a long time, so we don't need to treat the wound, yeah, because it's okay, the wound no longer appear, yeah. So we only need to treat just like the symptoms, yeah, in case, yeah. But when it is confirmed that it is rabies, so we need to get the rabies vaccine, yeah. The hospital, the local hospital can coordinate with the referral hospital to get the vaccine, yeah, because the incubation period is quite longer until months, yeah. So it is even though it can be postponed, yeah, as quick as possible, we need to get the vaccine. Yeah. At least it can reduce the mortality.
Okay, thank you so much, Nurse Lana, for your answers. Well, so I got the new knowledge from you by today's session. Thank you so much, Nurse Nana. Okay, now we have two people raising their hands. First of all, we go to Maharani Shifa Shafitri.
Yes, thank you, Miss Salsa, for the occasion. Hello, let me introduce myself. My name is Maharani Shifa Safitri. Thank you, Miss, for the material that you have been informed, share with us. I want to ask about the vaccinate rabies. Can we get the rabies vaccine without being bitten, Miss? Thank you.
Okay, thank you so much, Maharani. So, Maharani was asking about can we get the vaccines before we got um exposed to rabies?
Yes.
Okay, thank you so much, Rani. For Nurse Nana, do you want to answer it right away?
Yeah. I will answer. Okay. The question about can we get the vaccine before we get bitten, yeah, by the animals, yeah. Yes, you can, yeah. But at least for the pre-exposure prophylaxis, you need to pay by yourself, yeah. It is not covered by the government. And then in the international world, yeah, those who are in a direct contact or work, yeah, related to, related to the animals, like the officer in the zoo, someone who is feeding the animals, or maybe some people who has a pet at home, yeah, they need to get the they got the vaccine, yeah, before being bitten, yeah. But in Indonesia, this practice is still low, yeah, because they are not aware. They are not aware of the danger of the animal bite. So that's why maybe like the education, yeah, government education from the community, from the public health center is really important, yeah, to raise the awareness, yeah. So if the question asked about whether is it possible to get the pre-exposure prophylaxis, yeah, it is possible, yeah, but you need to pay by yourself. Does that answer your question?
Oh, okay. Thank you, Miss Nana.
Yeah. You're welcome.
Okay, thank you so much, Maharani and Nurse Nana, for answering the question. So we're moving on to Ayuna.
Okay, thank you for the opportunity. I'm Aina from Universitas Diponegoro. I want to ask that Ms. Nana says that the incubation period for the rabies virus itself is very long, maybe 2 until 3 months. But when during that time we accidentally come into contact with the saliva or other mucosa of the sufferer, will it transfer the rabies virus that is being incubated in the victim's body? Thank you.
Okay, thank you, Ayuna. I'll give it to Nurse Nana, maybe.
Yes, sorry. Yeah, sorry, I don't catch her last question. Is it possible to infect, during the incubation period, or the symptom will be appear during the incubation period or something like that?
Okay, Ayuna, can you confirm?
Okay, that if we contact with the victim in the incubation period, uh, will the rabies virus is transferred from the victim body to the
To the other human.
yes.
Okay,
Yes,
okay,
ma'am.
I understand what your question. Thank you, Ayuna. That was a great question. Yeah. So based from the evidence, yeah, the transmission or the spread of this virus, yeah, only from the animal to the human, yeah, not from human to human, yeah. Unlike the SARS or something like avian flu, yeah, or COVID-19, yeah. But this transmitted from the animal to human. So when you are getting in contact with a person who are infected but still in the incubation period, they will not spread the virus among humans. Yeah, so it's safe. Yeah. Based on the evidence, yeah, even though we don't know if there will be like a rabies a mutant, yeah, because right now the virus is develops, yeah, it replicates, yeah, become the new variant, and it can infect the human, and then human can infect another human. So we don't know, but right now the evidence say otherwise. So there is no evidence found in the transmission among humans. So only from animal to human. That's my question. That's my answer.
Okay, thank you so much, Ms. Nana, for the answer.
Yeah, you're welcome.
Okay, thank you, Ayuna. Any else wants to ask? Okay, I guess I'll wait till 1442.
Yeah, feel free to ask. I will be very happy to answer.
Any else wants to ask? Please raise your hands. if any. You guys also can put the question on the chat box. Okay. From Muhammad Nur Ohmans. Sorry, maybe I have question about what a difference between vaccine ERIG and HRIG. Nur Ohman asking about the differences between vaccine ERIG and HRIG.
Okay, sorry, I'm still muted. Yeah, sorry. Okay, thank you for the question. All right, the difference between ERIC and HRIC, yeah. So the HRIC, yeah, is commonly given to for the vaccine. This is the human rabies, yeah. This is not the vaccine, but immunoglobulin, yeah. So it is given after the prophylaxis, yeah. And then the human rabies immunoglobulin, HRIC, yeah, it is commonly given, yeah, for the treatment rather than the ERIC, yeah. However, the effectivity, yeah, between those, yeah, almost the same, yeah. But yeah, some studies still continue to investigate, yeah, the effectiveness between ERIC and then also HRIC, yeah, especially in the humans. But the practice and then the WHO recommendation, yeah, recommend the human immunoglobulin to be given than the equal one, the ERIC. I hope that answered the question.
Okay, thank you so much, Nurse Nana. To Muhammad Nur Ohmans, is that answering your questions or any else? Maybe you can give a confirmation.
Maybe
Okay.
for further information, the human immunoglobulin, yeah, it is derived from the human plasma, while the purified, yeah, the actual, the immunoglobulin derived from other than the human one, yeah. So the practitioner choose to the HRIC, yeah, then the ERIC.
Okay, thank you for the knowledge, Nurse Lana. For Muhammad Nur Ohmans, maybe you can give a confirmation that if it's already answering your questions. Is it clear enough? Okay, so there is another question. It says here that, so I have a follow-up question about the stock of vaccine is limited. So what's the question?
So if the vaccine supply is limited, so yeah, and then also this is like the question asked by Sultan, yeah, in the remote and then poor facility countries, yeah. Sometimes it's difficult, and yeah, we only do the conservative treatment, yeah. if there is no the human immunoglobulin, then you can use the equine, yeah, the eric immunoglobulin, yeah. However, if there is no immunoglobulin, yeah, so we only just give the post-exposure prophylaxis, yeah. If there is no prophylaxis, yeah, so we only manage the symptoms, yeah. That will be the palliative care or the conservative treatment, yeah. Yeah, the worst case scenario, the patient will likely die. It's sad, but that's the condition. So that's why maybe government needs to pay attention to the remote area, at least, yeah, give like sufficient supply, yeah, in one local area. So if the public health center cannot have that, yeah, they can refer to the local the referral local hospital in that area to get the vaccine and then the immunoglobulin.
Yeah, thank you, Nurse Nana. Is that answering your question, your Omans? Or maybe you want to clarify the other? Okay, it's clear enough.
Thank
Okay,
you.
okay, thank you so much, Muhammad Nur Ahmad, and thank you so much to Nurse Nana. Since we already come to the end of our discussion on emergency nursing in handling rabies as a zoonotic disease, I want to express our gratitude for your active participation and engagement. The insights shared today underscore the critical role that emergency nurses play in identifying, managing, preventing the spread of this potentially deadly disease. Your dedication to the well-being of patient and the public is commendable. Also remember that the fight against zoonotic diseases like rabies requires a collaborative effort across the healthcare sector, public health organizations, and the community. Our work as healthcare provider is a fundamental part of this collective effort. Um, okay, so before, I guess it's enough for our discussion. Before we close the session, I think I'd also like to take photos online with you, Nurse Nana, and our audience as well. I think for the audience, can you turn on your camera since we're gonna taking a screenshot together? Okay, I think I'm gonna count 2, 3. Okay, 1, 2, 3, cheese. Okay. Okay, thank you so much again, Nurse Nana, for your enlightening presentation and new knowledge you gave us today. So in closing, I'd like to extend our appreciation to the experts and speakers who shared their knowledge, as well as to our audience for their insightful questions. Together, we are better equipped to handle the challenges presented by zoonotic diseases. Please stay informed, stay vigilant, and continue your exceptional work in the field of emergency nursing. We look forward to seeing our future events where we will continue to explore and address critical issues in healthcare. Thank you for being a part of this important discussion. I guess on behalf of me, I'd like to apologize for any inconvenience and shortcoming during the conference. I think I'm Sausan Ritni signing off as today's moderator. Good afternoon, goodbye, and take care. To Fadil and Lotusha, the time is yours.
Lausan. And of course, thank you so much, Mr. Muhammad Muin and Ms. Nana Rohana, for such insightful topic. We learned a lot from that. Don't you think so, Fadil?
Yeah, we learn a lot about other things that we see through our net today.
True. But ladies and gentlemen, finally we get to the last session in this seminar with this closing. But before we close the seminar, I would like to remind all of you participants today to fill the evaluation form using the link on your chat room. All right, let's take a photo together, I guess, for documentation. Next, maybe I will invite the operator to guide the documentation. Please turn your camera.
Please, everyone, turn on your camera because we're going to take our last documentation session.
All right.
Okay, I will let the committee help us taking the picture. Okay. Okay. Right, I'll count. 1, 2, 3. Sekali lagi. 1, 2, 3. Okay, all right.
Thank you very much. Thank you all for being willing to attend this PIHO 2003 seminar and paying close attention to the materials. Hopefully, we all get a lot of knowledge from today's great seminars. Next, thanks to our great speakers for their knowledge. Lastly, me, Lotusha Citra.
And I, Fadil Number.
See you again in the next seminar. Bye.
Bye.